What's up, guys? Today we'll be looking at a contraceptive device known as a Nuvaring or vagina ring. So, a Nuvaring is a hormonal contraceptive device, a small flexible vaginal ring used to prevent pregnancy. What exactly is a Nuvaring? Nuvaring is a monthly vaginal ring that releases a combination of estrogen, that's ethinyl estradiol, and progestin, that's ethanogestrel. It works similarly to birth control pills, but is inserted into the vagina rather than taken orally. So, a Nova ring is actually a flexible ring, as you can see here. It's a form of hormonal contraceptive, but instead of being taken orally like postnorm, it is rather inserted into the vagina for convenience, especially for people who don't like taking pills. How does it work? Nuvaring prevents pregnancy by inhibiting ovulation, that's stopping the release of an egg. Fertilization usually occurs during the period of the menstrual cycle known as ovulation. So what this ring does is that it releases hormones that prevents ovulation, so fertilization does not take place at all. It also thickens cervical mucus, making it harder for sperm to reach the egg. So it doesn't just inhibit ovulation, it also thickens the cervical mucus. When the mucus there is thick enough, sperm find it difficult to swim through, therefore preventing its reach to an egg, subsequently preventing fertilization. It also thins the uterine lining, reducing the chance of implantation. Thus, if in case there is a chance of fertilization, it also thins the uterine lining. This will reduce or prevent implantation of a fertilized egg, thereby even if an egg got fertilized, it will be unable to attach to the walls of the uterus, hence resulting into a prevented pregnancy. So how do you use it? First, you insert the ring into the vagina and leave it in place for 3 weeks. Remove it for 1 week. This is your ring free week when you usually get your period. So this 1 week, you remove the vaginal ring to experience your period comfortably. Then you insert a new ring after the seventh day. That's after the 7 day break for a better experience. So, how do you insert a vaginal ring? You should always remember to wash your hands before inserting your vaginal ring. The ring can't get lost inside you, so never be scared. Never flush or keep your ring when you're done. Pin it. So, first, squeeze the ring between your thumb and finger, as you can see here. Then, gently insert the tip into your vagina. See this person inserting from the tip into the vagina. Slowly push the ring up into your vagina using your index finger until it feels comfortable. You use your index finger because it creates a better chance of inserting it more conveniently, hence it is the most comfortable. Fourth, unlike a diaphragm or cap, the ring doesn't need to cover the entrance to your womb, that's the cervix, to work. But if it feels uncomfortable, you may not have pushed it in and you feel like, oh, something is in my vag, then it certainly means that you have not inserted it deep enough. To remove the vaginal ring, insert a finger into your vagina and hook it around the edge of the ring to gently pull it out. No stress, right? It should be inserted and removed on the same day of the week and same time of the day for best effectiveness. So you should always remember the week you inserted it, the time and date, so that when you come to remove it, you do it on the same time, week and date you did it for the best effectiveness. So how effective is a vaginal ring? Over 99% effective with perfect use and around 91% effective with typical use. Thus, if you use it perfectly, you should expect to get 99% results. But if you use it typically, you should expect to see a minimum of 91% effectiveness. So, what are the benefits? Only needs attention once a month. This is not something you come to check every day. You just fix it, and when it's time to remove it, In order to experience your period, you do so. May reduce period pain and regulate cycles. For women who experience painful menstrual bleeding and have irregular menstrual cycles, you can use a vaginal ring. It will reduce the chances of you having such pains and also regulate your cycles. Low maintenance compared to daily pills. You can imagine the stress of taking pills every day. So with a vaginal ring, you can just fix it there, relax and enjoy the benefits. So what are the possible side effects? The most common are nausea, breast tenderness, that's pain. You feel pain when your breast is touched. Mood changes, vaginal irritation or discharge, less common but serious. There could be increased risk of blood clots, stroke or heart attack, especially if you are a smoker over 35 years. So who shouldn't use this ring? Avoid Nuvaring if you are over 35 years old and you smoke, have a history of blood clots, stroke or certain cancers, have uncontrolled high blood pressure or migraines with aura. You can remove it for up to 3 hours during sex or other activities, but it must be reinserted within that time. So you can take a break from it within 3 hours and still insert it back within the same 3 hours. It does not protect against STIs. This is not something you insert and have unprotected sex and think you won't contact hepatitis, gonorrhea, or even HIV. It only protects against unwanted pregnancy. Be reminded. So we're gonna answer some questions about a Nova ring. A. It contains ethinyl estradiol and the ethanogestrel. Yeah, it's true. The ring is placed within 5 days of menses onset and after 3 weeks of use is removed for 1 week to allow withdrawal bleeding. It's also true. C. It contains ethinyl estradiol and the progestin nor norelgestromin. That's false. It actually contains ethinyl estradiol and the progestin norelgestromin, which is false because that's the patch, not the Nova ring. The Nova ring does not contain norelgestromin. So D, transdermal patch and vaginal ring produces metabolic changes, side effects, and efficacy rates comparable to those with COC pills. It's true. It may be removed during intercourse but should be replaced within 3 hours to maintain efficacy. That's also true. Thanks for listening.